is a public service announcement about Huntington's disease.
What is Huntington's disease? It is a genetic disorder that causes the progressive breakdown of nerve cells in the brain. It causes difficulties and changes in a person's cognitive skills, motor skills, and mood. It is caused by a defective gene on chromosome 4, and if a person inherits the gene from a parent, they will develop the disease eventually. Symptoms of Huntington disease usually develop between 30 and 50 years old. If you have symptoms such as muscle problems, involuntary jerking or writhing movements, depression, mood changes, anger and irritability, impulsive decisions, forgetfulness, speech production or swallowing issues, then you should talk to your doctor.
If you are experiencing any symptoms of Huntington's disease, your communication may also be impacted. This includes dysarthria, hoarseness of voice, slurred words, the inability to control speech volume, inappropriate pauses between words. Your speech organization may be impacted from frontal regions of the brain being damaged. You understand what is being said to you, but you can't communicate what you want to say. Changes in mood can affect your communication. You may easily be distracted. You may avoid conversations and have a tendency to become fixated on certain items that seem important to you. When trying to communicate with someone who has Huntington's disease, reduce distractions during conversations, so try to speak in a quiet place away from the TV. Speak slowly and talk about one thing at a time. This allows them to process what you're saying. Ask direct questions like yes or no. Use nonverbal communication, hand gestures, facial expressions can be useful also. So what is the SLP's role in this? They do breathing exercises, relaxation techniques, voice therapy. They educate patients, caregivers, family members, and friends on methods to optimize communication. They may implement a AAC device, and they also will discuss anxiety associated with the disease.
Lastly, some tips for caregivers. They can use the communication strategies mentioned, like ask yes/no questions, wait extra time for them to respond, ask one question at a time. Also, they can make modifications in the home, like seating or sleeping arrangements, nutrition changes, safety modifications. It's also important that they educate themselves about the disease, join a support group, and make sure that they take care of themselves as well.
Please call a doctor if you're experiencing any of these symptoms. Thank you.